then maybe we can move on to the questions that we've received from the audience. So the first question that we've received is, were these programs CSR funded or business costs? So maybe Shushmita and Federica, you can answer that. Shushmita, you can go first.
Yeah, hi everyone. Thanks, that's a great question. So speaking for this particular project and the ROI tool, it was funded by UNFPA, and here I think as research organizations, especially nonprofits, we're quite reliant on organizations that fund us. So in this case, UNFPA was our funding partner, and they were the ones who in fact came to us with the requirement, and we were really fortunate to have the opportunity to work on this. But yeah, GBL partners with various different organizations, and we also get some of the funding through grants. And yeah, so we're really dependent on this kind of external funding in order to be able to continue our research and then pay that forward. Yeah. And I think Federica can expand on that.
Thank you, Sushmita. Thank you for the question. Yes, as mentioned, we are the Workplace Access to SRHR program was funded in the broader context of donor-funded projects for UNFPA. And I think that, thank you, Sonvi, I see your question in the chat. You meant the implementation of the projects, right? So the ROI tool itself is a projection tool. So it's meant to estimate what would be the costs required for the implementation of the interventions. And concerning your question on who pays for Shahi's implementation of health projects, I will defer to Mr. Deepak, but I just want to share here how the ROI tool allows businesses to project the costs. What would it cost to implement this intervention? And in the cost section of the projections, we have inputted some default cost based on our research. For example, how much does it cost to buy iron folic acid tablets or sanitary napkins and so on. All of those costs can be customized. So if your organization or a company has information on the local costs, for example, the local market cost of the products or the medicines and so on, or even of the trainers for the interventions that require training, all of the costs in the tool can be updated from the default values provided. So to really give a sense of the real projected expenses in the local context where the projection is being made. But I'll pass it over to Mr. Deepak for Shahi's.
You see the complete cost. When we started these interventions, this journey technically started around 10 years ago. By and large, these have been self-funded projects till date. You know, we have been funding from the Shahi's and Shahi's Kitty from our own profits. And fortunately, our management started to observe benefit from these interventions. You know, because you know, absenteeism and attrition is a big problem in the labor-intensive organization. While you are doing, GBL is doing research now, we are actually able to delve into a very finer points, very deeper points, you know. But before these researches, we could see, the business could see benefit in the attrition control, you know, people were not leaving as much. The management observed that people, the absenteeism, it improved. There is another aspect which is never talked about, that is unauthorized absenteeism. It is a bigger curse than absenteeism. You know, imagine we have got 1,000 machines lying and we are planning a new style in a particular production line. And 5 key important workers, you know, operators, they have taken leave without informing. It happens because they are not to be blamed also plenty of times, because their life is also not that easy, you know, because of transport, because of kids, plenty of times, you know, they take unauthorized leaves. So this is a bigger problem than the leaves actually. So when we started to invest in these programs, especially trainings, attitudinal trainings, then the business started to see some respite from all these factors. So they started to fund it. But now, when we are actually launching the programs like like Iron Women, in which we are helping our women workforce with the iron supplements. So there are government schemes in which we are taking its support. We are taking the benefit of these government bodies like ESI, who is helping us with the iron supplement tablets and other components. We are also looking in for some, we have not done it, but we may look in for the CSR funding, which can support the women workforce also. Till now, predominantly it has been self-funded, but we are exploring into, take support from outside also as well.
Thank you, Mr. Deepak. I think we can move on to the second question. This is for you, Sushmita. How much involvement does the tool need from GBL? What kind of scale, simultaneous number of companies can this tool support?
Yeah, so here I'd like to say that while GBL was involved in the design and development of the tool, it's now a product of UNFPA. So it's really where they take it from here, but we'll definitely be involved in seeing where that goes. And I think Federica can speak better to the technical aspects of how many businesses it can support. But being a freely available online tool, it was designed to not be very heavy and like it loads easily and all that. You can try it out for yourself. So over to you, Federica.
Thank you, Sushmita. Yes, so the tool is hosted on UNFPA's website, so it's free to access for everyone. You can go onto the link, have a read at the programs and the way it works and how it has been created, and you can essentially create a profile and start trialing out projections. So there shouldn't be any need for support, because we have a ROI tool guide and videos there created to show you how to do the projections, which you saw a little bit at the beginning of this webinar. So it should be really intuitive and self-explanatory. And of course, there are some contact details in the tool. If you have questions, and you can contact UNFPA and ask us any question for support. But as Sushmita said, GBL has really been our research arm for this. We couldn't have done it without them, and the time that the team spent in the research phase before, and then in the design and creating the tool itself. But it's freely available on our website, and you're all very welcome to trial out projections. And the projections, you can make as many as you want. You can make projections for all of your employees, or you can target them. For example, you can do a specific factory, or you can trial out one intervention first in one factory and then see how it goes from there. Thank you.
Thank you, Federica and Sushmita. I think the next question is also for you, Federica. How do you see the potential of such tools to support rights-based frameworks for workers' health and workplace rights?
Thank you so much. Excellent question. And I think really this was the core of what the ROI tool wanted to support. There are interventions in the ROI tool which are not just service provision, for example, like iron folic acid or sanitary pads, but there are also interventions related to training and peer-to-peer training. And there's one specifically on sexual reproductive health and rights. So the idea is that by providing workers with the opportunities to learn, and also Mr. Deepak really explained, right, in his examples from Shahi's factories, it should create an environment where workers can become more empowered. And by implementing the interventions in the factory, also get to explore more about their sexual reproductive health and rights, but also beyond. It's also life skills training and knowing, for example, some basic economic management, money management, financial skills, all of that. So we really hope that by showing the returns on investment for implementing the interventions, the tool can become a conveyor of the importance to invest in workers' rights and workers' well-being. So that's the framework for which the tool was designed and created. Thank you.
Amazing. Thank you. I think the next question is also to you. What is the plan to scale the tool with other corporate houses? Are there more examples of corporate being sensitized and adopting the approach and the tool? And maybe there's one more aspect I would like to add to this. Are there any particular sectors which you see this tool being used as much? Because we tested this with Shahi, which is like a big apparel manufacturer in the garment space, right? So do you see any other sectors also being involved while scaling up this tool?
Thank you so much. So the tool, we've started to use it and orient business partners in Bangladesh, through our UNFPA country office colleagues as well in Bangladesh. And we've presented the tool and we've shown how it works to the Bangladeshi manufacturer associations. There are many, of course, as you know, there's the BKMA or the Garments Association, the Leather Association, footwear, and also to the brands, because that's also a part of our engagement related to the ROI tool, is also to show the corporations and the brands like H&M and Primark and Uniqlo, how they can also be promoting the use of the tools in their partner factories and in the companies that they use to create the garments. So Bangladesh at the moment is our first country where we're starting to pilot some of the interventions, but also the previous version of the tool, and hopefully now also this expanded one, was used in the Philippines a lot. Our actually original program was in the Philippines, and partners who have used the tool there really saw the impact in terms of increased productivity and returns. And it's also interesting because in the Philippines, and it's related to your question, Rochak, we use the tool also in industries that are not related to garment or apparel. For example, we had industries in the tinning industry for fishing, canning, so doing the tuna cans and the fish cans and all of that. But in the Philippines as well, there's quite a sizable female workforce in the manufacturing sector. So of course that was a very good entry point for UNFPA. But experience from our colleagues in the Philippines also shown that actually the male workers benefit a lot from the program. So in the tool, there are some interventions, of course, that are strictly related to women, for example, menstruation intervention and iron folic acid. But all of the factory, clinic, the subsidized SRHR products, the training, it can also be, of course, provided to male employees. And in the Philippines, we have testimonials from male employees of the factories where they said, I really learned how to better plan my family with my wife, for example. So it shows that there are very broader opportunities to involve the whole workforce and not just the female employees. But having said this, we're excited because the tool has just been finalized, really. So we're at the early stages of getting to know our partners and market the tool around. So we're looking forward to potential opportunities to collaborate and use this in other sectors and in other countries as well. Thank you.
From a business point of view, what are some gaps in the domain of workers' health that can be filled by research organizations?
Research organizations can partner with a lot of industry, a lot of business points across industries. It is when so there are strong evidences now what we are creating in terms of the benefits and the business benefits which the industries and organizations can enjoy by investing in certain uh, aspects. For example, hygiene is one of the big aspects where the research organizations can partner with the organizations. If something can be done in terms of the hygiene across the manufacturing, believe me, it can have a great impact over a lot of absenteeism, because hygiene is one big factor because of which the workforce, they fell sick, they are not able to come to work, and it impacts the profitability directly. Some of the factors like eyesight, as I shared with you, is a big component. The ignorance of the female workforce, in terms of these important elements like eyesight. This also is a big area for the research organizations to partner with. The biggest opportunity which I see, mental health. This is something which less people are talking about. Mental health is a big area where the research organization has a huge opportunity to partner with the industries. Because of mental health, if this can be supported with the help of the research organizations, and if you can weave interventions around the mental health for of female workforce especially, because if you see closely, they have got a tough life basically, all across. They have families to feed, they have kids, they travel all across, then they work for 8.5 hours. So it's a complete challenge. So if there are interventions over the mental health, and the research organizations can partner with the industries so as to show it that how beneficial it is, I think a lot can be done in the domain of mental health. It would directly help the female workforce in terms of their physical well-being also. All right, so they can be motivated to take up better practices, better health practices, be calm, be happy. So imagine if you can do something about the happiness in the terms of this women workforce. I can guarantee they can turn on the complete production of any manufacturing unit. So it is just a matter of looking at these areas like mental health as a great opportunity, and for the research organizations to partner with these manufacturing organizations to show the benefit. I think these are big and creative business strategies. They cannot be ignored by the industries, because industries like apparels, constructions, labor intensive, pharmaceuticals, labor intensive, they have done everything under the sun today to improve their productivity. Believe me, apparels, textiles have done everything to improve their productivity. And still now we are not understanding where to go. But these are new areas to go, which can have a direct impact. We work with women workforce, we work with people, and we work with machines. So unless and until we don't invest in these people, I think this is a sure shot strategy for the businesses. So these are a couple of areas which I feel research organizations, they have a huge scope to partner up with the industry, which can actually boost up the complete, and dynamics of these labor-intensive industries.
Absolutely, great points. So yeah, that's I think all the questions we have for today. Thank you everyone for joining in. Do contact us if you want to partner with us, if you want to learn more about our work. There's the info@Good Business Lab ID there, so you can drop a mail there and we'll reach out to you. And thank you so much for joining in. Thank you everyone. Take care and have a great evening.
Thank you so much for the great questions.
Thanks everyone.
Bye.
Thank you.
Bye.
Bye.
Thanks, Frederica.